Namaskar and a very warm welcome to this edition of our program Let's Talk Health Gynae Queries. I'm Nidhi Kumar and you're watching India Science. Well, friends, India's cumulative COVID 19 vaccination coverage exceeds 184 crores, and India has reported only 913 new COVID cases. More than 2.84 lakh vaccine doses have been administered in the last 24 hours, and the recovery rate currently stands at 98.76%. As COVID 19 continues to surge in the world, some queries are on the go. People are speculating about health problems, and we get you queries on gynecology issues today. In this program, we take your questions from Facebook and YouTube live. And today we are joined by the very eminent Dr. Sarika Gupta, Senior Consultant Gynecologist, Oncology and Robotic Gynecology, Indraprastha Apollo Hospital, New Delhi. Many thanks for joining us, Dr. Sarika. Thank you so much.
Thank you. Thank you for inviting me.
All right, I'll start with my first query and question. Menstrual problems are very common in a woman's life, doctor. So, when should you actually see a doctor? And what are the, basic menstrual cycles, if you could elucidate?
Yeah, so this is a very good question because menstrual problem are very common and every woman in have experienced some or the other menstrual complaint in their reproductive lifetime. So maybe it can be heavy periods, it can be delayed periods, it can be early periods, or it can be painful periods. So something or the other related to menses, it's a very common complaint. And everyone should know what is the normal cycle and when they should consult a doctor. So a normal menstrual cycle usually varies between 22 to 35 days. So that means that if your periods are in between 22 to 35 days, then that cycle period is absolutely normal. Or if you are having periods which are less than 22 days, that is 20 days, 15 days, you are having periods every 15 days or 20 days, or you are having delayed periods like every 1.5 months or 2 months, then it is abnormal, or and you should see a doctor. Now also depends upon the amount of bleeding. So usually average amount of bleeding is 80 ml, and that is 3 to 4 pads a day, and that can actually 5 to 7 days of bleeding. So anybody who is having periods which continue for more than 7 days, which is they are using more than 4 pads a day, and I would say 7 to 8 pads a day, or changing their pads every 2 hours, or passing big clots, that is abnormal bleeding, you should see a doctor. If the pain in your periods is actually affecting your life routine, you're not able to go to the school or to your workplace, then it's abnormal period, you should see a doctor. So one should know what is normal cycle, and then if there is any discrepancy, then you should see a doctor and get yourself evaluated.
Absolutely, doctor. Another question that I would like to ask you is that many times a biopsy is advised for heavy periods. Do you recommend it?
Yeah, absolutely. So many times we, first of all, for any woman who's coming with menstrual complaints, a gynecological examination, internal examination is done, and a ultrasonography, which is internal sonography if she's sexually active. So internal transvaginal sonography is done and examination is done. And if all these things are normal, then we if all these things are normal, or if the endometrial thickness, as per the endometrial thickness, we advise endometrial biopsy, because if there is a suspicion of malignancy, then it is uh, then to actually for diagnosis we need the biopsy. So I recommend biopsy for most of the women who are in the perimenopausal age, that is after the age of 40. Most of the time, if they have abnormal bleeding, they should undergo a biopsy.
Yes, doctor. My next question is, what are the symptoms of breast cancer, and what would you advise during self-examination so that young girls or young ladies or even older ones can, decide when to see a doctor?
So, breast cancer is the most common woman cancer in the world, even in India now. So, everybody should know the symptoms of breast cancer. So, it is any abnormal swelling in the breast or in the armpit, and any change in the skin of the breast, or any discharge from the nipple, That is, it can be blood stain discharge, greenish discharge, or any kind of discharge, or skin changes in the breast. So if you have these problems, swelling, lump, then you should immediately see a doctor.
But a lot of people also feel that the underarm swelling also happens after feeding, because we keep getting these questions. Is that also true, doctor?
See, so that tail of the breast is always there, which goes into the axilla, and that gets hypertrophied at the time of feeding. But if you're feeling that this is a little bit different than what you had earlier, then you should see your gynecologist. Means if you are breastfeeding, there is a gynecologist who is seeing you. So go and ask your doctor that whether it is fine. And once she examines and she can reassure that this is normal, then I think it's fine. But otherwise, don't neglect it. Even if at the time of lactation, also don't neglect it. If you see any abnormal swelling in the breast, even in the armpit, see your doctor.
Absolutely. We have another YouTube question. This is Ananya calling from, I think, Ghaziabad. She says she has unbearable pain during her periods. So, what medication would you recommend? Unbearable is the key word, doctor.
Yes, so unbearable is the keyword here. That some amount of pain is expected, and that is a normal. That is considered normal. So if you're having some amount of spasmodic cramping pain, that is normal, and that happens because the uterus wants to expel through the contraction. It wants to expel the blood and the products inside the cavity. If it is unbearable, it is related to some or the other disease of the uterus, and most of the time it is endometriosis or adenomyosis or fibroids or anything else. So if it is unbearable, always go to the doctor, and once they see that there is no disease, then they can advise you just a painkiller. And if they find a disease, then they will give you treatment for the disease, so that the pain will go away only with the appropriate treatment of the underlying disease.
Yes, doctor, you just spoke about fibroids. Interestingly, my next question is on fibroids. What are they, and how do you, assess whether a fibroid is cancerous?
So fibroids are neoplasm, or you can say tumors of the muscle of the uterus. So it is a benign condition, and it is very common. So 50% of the women have fibroids, either small, big, can be symptomatic or asymptomatic. Sometimes they're just lying there, and uh, there is uh, there is no complaint with that fibroid. So we don't treat a fibroid till they are more than 5 centimeters big, or they're causing other symptom or anything else, infertility, heavy bleeding, pain. So till the time they are not causing, they are causing symptom, or if they are very big, causing pressure symptom, we don't do any surgery for it most of the times. And and it is a benign disease, and transformation into cancer is very rare. It is only 0.5%. So one lady having fibroid, two out of 200, if 200 women are having fibroid, one will have transformation into cancer. So you need to get ultrasound and find out what it is, or what the tumor it is. And if your doctor thinks that they want to get a MRI, then get it done. And they can assure you, once they see the reports, they can assure whether it is just a fibroid and not cancerous.
Yes, doctor. Another important thing that is coming to my mind is that women are conceiving late, even in India now. If you go by the general statistics, that is very prevalent now. So, what are the problems related to increased age in pregnancy? If you could tell our viewers in detail how important it is to have a baby, between what time frame, and how healthy that baby could be. What would determine these factors?
Yeah, so that is true that now, because of the women are taking professional courses, and then they are pursuing their career as a men are. So most of the time, even the marriage is delayed after 30 years, and then after marriage they want to delay the pregnancy for another 3 4 years. So the first pregnancy happens close to 35 years, and any pregnancy which is happening close to 35 years or more is called, a special term for it is elderly primary gravida. And this diagnosis comes with a lot of, I think, complications related to pregnancy. First of all, as late, if you are trying to conceive late, like you got married at 28 and you want to conceive at 35, it is eggs in the ovary are constant in women. And as the age progresses, those number of eggs actually become less, so it becomes a little bit difficult, first of all, if you want to conceive late. And once you conceive also, the chances of abortion, the chances of yeah, birth defects, the chances of means mental retardation, chances of abortion and low birth weight babies, and maternal problems also, hypertension, gestational hypertension, diabetes. So all these things increase, and many complications actually increase as the age progresses. So the best time I would say is between 25 to 30, 32, 33. If you can complete your pregnancy, I think the ideal thing would be that you complete your family before the age of 35. And if not, I think today you can see that women are conceiving even at the age of 50 with donor eggs, or even with their own eggs with the IVF. But then a number that becomes a high risk pregnancy, and many more things, many, they have a risk, they have associated risk involved with it.
Yes, ma'am. My next question to you is, what are the symptoms of cervix cancer and what is cervix cancer? What is the difference between cervix cancer and uterus cancer or ovarian cancer?
So, see, cervix is the mouth of the uterus. So, uterus, uterine body is the womb where the baby develops, and the cervix is the mouth of the uterus, or the body of the uterus. And once the cervix dilates, then the baby comes out. So, and below the cervix is the vagina, which is like 7 to 8 centimeters long, where a lady gets penetrative sex, and above it the cervix. So cervix is visualized by the doctor when they do a vaginal examination, the internal examination, they can see the cervix. So that is the cervix. And what are symptoms of cervix cancer? So cervix cancer is also very common, and it is caused by a 90% of the cases, cervix cancer is caused by a virus, human papilloma virus. So cervix cancer is caused by human papilloma virus, and like the COVID, like the coronavirus. So it is also and it is such a virus that can change the normal cells into cancerous cells. In a period of years, it can change the normal cells into abnormal cells. So symptoms are abnormal bleeding, that is heavy bleeding, or which is continuing for 15-20 days, maybe continuing for months together, and the lady will completely irregular periods. Lady doesn't know when the periods are going to happen, completely irregular, and maybe in 10 days, sometimes in 10 days, sometimes in 5 days, so completely irregular periods. Or once the lady has stopped having her periods, like after menopause, if she starts bleeding again or spotting again, that is a symptom of cervix cancer. Foul smelling discharge from vagina is a symptom of cervix cancer. And once this cancer actually progresses to actually involves the nearby organs, then pain and bleeding after sex is also a symptom of cervix cancer.
Right, doctor, you mentioned all these points interestingly, but people also would like to know from you that what is the treatment and what is the kind of surgery, if at all, required for these problems. What should a person do if he realizes that he had, if she feels that she has this cancer?
So for early cases, so cervix cancer is one cancer which is completely preventable, or if not preventable, then we can detect it in a very early pre-invasive stage by doing regular Pap smears. So if we can detect it in a very early stage, we can do a small procedure which does not even require removal of the uterus. So in the pre-invasive stage, like in the stage 0, we can do just the excision of the cervix, and in the stage till in the very early stage 1, we can do surgery and removal. It is extensive surgery as compared to a normal hysterectomy. So it can be treated and cured by surgery. But after a certain stage, I would say after 1B stage, if the cancer is more than 5 centimeters, 4 or 5 centimeters, then she needs like multiple therapies. She might need surgery also. She might need radiation therapy, chemotherapy. So once it is diagnosed in advanced stages, then it might need multimodal therapy, which involves chemotherapy, radiation therapy, and sometimes surgery also. So it is important for cervix cancer. You want to reduce the mortality, morbidity, to detect it early by Pap smear and HPV test.
Yes, doctor. The next question comes on YouTube from Shivam from Noida, and he wants you to tell us what is PMS in detail. Thank you.
Yes, so premenstrual syndrome. So this is also very common, and especially in early years of when a girl starts having a period. So this is like physical symptoms and psychological symptoms which are related to the cyclical hormone change in the body. So the physical changes can be breast tenderness and cramping, lower backache, or fatigue. I would say fatigue. And the mental symptoms are mood swings, anger, craving, food craving, and I think this is the main thing, that and bloating. Physical changes are bloating also, where they feel that they have gained weight, and they gain of like 2-3 kgs in those days. So this is premenstrual syndrome, and it is happening because of the cyclical changes in the female hormones, and many times if it improves with the age, and if it doesn't, and if it is actually affecting the lifestyle, then they are given hormonal medications are given by the doctor. Some other like stress relieving exercises are told, and sometimes the lady might need anti-anxiety drugs or antidepressant also
Yes, doctor. Now I would request you to please highlight,
because of the mood swing.
and we want to know what to do and what to take, and how do you, they also go through these mood swings.
Yes. So menopause, usually the average age of menopause in India is 50 to 51 years. So sometimes women have it like early, after they start having it after 45 years of age. So symptoms related to menopause are mood swings and hot flashes, irritability and forgetfulness and fatigue. So all these things happen when you start, means when you stop having your periods in the early first or second year. These symptoms are the maximum, and after 2 years you might have symptoms of frequency of urination, dryness of vagina, and I think mainly these symptoms, that urinary symptoms. Uh, so, what is the treatment, and what just to have a healthy menopause? I would suggest that first of all talk to people who have undergone menopause, so that you know that these symptoms, a little bit of hot flashes and mood swings, are normal. These happen for forgetfulness. This happen at that point of time, and talk to women who have undergone menopause. And another thing is that now is the time, you have to understand that now is the time you have to take care of your body more, and you have to understand the warning symptoms of cancer, because cancer is more common in after menopause. So you should know all the warning symptoms of cancer in of breast cancer, ovary cancer, uterus cancer, and you should know that now, because estrogen is not there in your body, you might have bone loss, and your bones will become weak. So you should start taking calcium supplementation. You should start taking more care that you get your pap smear regularly now. You should get your mammography regularly now, and uh, take a multivitamin if at all your diet is not balanced. Take care that you are doing some physical exercise, and you are taking control, you have a healthy weight. So I think this is important at this age to understand. And if you are having vaginal dryness, then talk to your doctor. They can give you some medication. If the mood swings and the if the mood swings and hot flashes are taking a toll in your life, you're not able to sleep, you're so anxious that you are having panic attacks, so then you should go to a doctor, and they can give some medication which can help with this menopausal syndrome, this menopausal problems, severe menopausal problems. They can also give you hormone replacement therapy if at all you are the right candidate for it.
Yes, doctor. What happens if the lining of the uterus becomes thick? Are there any symptoms associated with this? Does this actually happen, or is it a fallacy?
Endometrial lining can become thick, and when we get ultrasound done, we look at the lining, that what is the average. So there is a average uh, lining in reproductive age group, and there is an average lining in the menopausal group, which have stopped their periods. So once you stop your period for like more than a year, then your lining should be less than 4 to 5 millimeters. So if it is thicker than that, then the doctor most of the times gets a biopsy done, because that is a risk factor that you might have uterus cancer. So thicker lining, very thick lining, cystic, and which is very vascular. If the doctor sees it's vascular, then they will advise a biopsy. So it is not a myth, and but more relevant in a menopausal woman.
Yes, doctor. Another question coming up on our YouTube by Dolly is that her mother has ovary cysts. What are the ovary cysts? How do you define them, and do they need to be operated or can medication work?
So ovary cyst is also very common, and ovaries produce eggs, and then eggs are ovulated, and then some space is left behind, and then after that some bleeding happens in the ovary, and a remnant small cyst is left behind, which is called functional cyst. So most of the time in reproductive age group, a woman, you get an ultrasound, you will see some or the other cyst in the ovary. So that is absolutely normal. Some absolutely normal to have some small cyst in the ovary which has blood or some completely filled with water, and the doctor sees the ultrasound and they can tell you whether it looks something abnormal or not. But for somebody who's postmenopausal, then the ovaries have stopped working. So any kind of cyst in a postmenopausal woman, like as she said that her mother, maybe she is postmenopausal. So at that age, I think all cysts are suspicious. So you should get a proper evaluation, and after some blood test also, the doctor will decide what kind of surgery she will need, and if at all she needs follow up, because most of the time surgery is required in postmenopausal women.
Yes, doctor. Another query that is always seen with women is frequent urinary infection. Uh, what is the reason for recurring UTI, if I may ask you?
Yes, so I think this is also a myth sometimes. See, there are two types of infection. One is vaginal infection, vaginitis, and another is urinary tract infection. So these two things are separate. The vaginal infection can later on cause urinary tract infection, but most of the time urinary tract infection does not cause vaginitis. So women many time, most of the time in reproductive age group, when they are having sexual contact, they can have sexually transmitted vaginal infection, and because there is burning, itching there, and there is raw area, and if they pass urine, then they think that you are there. Their main problem is burning during passing of urine, but most of the time it is a vaginal infection. So if at all they think that it is burning of the urine, they should burning of the urine, then they should see a gynecologist. She will get a ultrasound, or she will get the urinary test and a culture. And if at all they have urinary infection, then it will be treated. So, woman needs to know whether it is vaginal or urinary infection, and why a woman has recurrent urinary tract infection is maybe she has recurrent vaginal infection because of the partner. So her partner needs to be treated. If the partner is treated, she will not have recurrent vaginal infection. And another thing, there are many reasons why a woman has recurrent urinary infection. There can be a stone in the ureter. She can have stone in the ureter or hydronephrosis or any other disease in the bladder also, which can cause recurrent urinary tract infection. Hygiene is one important thing, but I don't think that this is the main reason that even somebody who takes care of her hygiene might have recurrent urinary infection, can be related to disease of the bladder or the kidney. And hygiene is important. You should take care where you're sitting, and if at all there is the place is not clean and hygienic where you're being, then you should have some sanitizer or something so that you can clean you use a clean bathroom.
Yes, doctor. Now, if you could go on and explain to all our viewers what is endometriosis and what are chocolate cysts. Dr. Sarika, can you hear me?
Hello.
Yes, I think we lost the audio. I'll repeat my question. What is endometriosis and what are chocolate cysts? Can you hear me, doctor? Hello? You're watching India Science and we are talking of gynecology queries. With me is Dr. Sarika from Apollo Hospital, and we've just lost the audio. We're just getting back to her. Meanwhile, please keep sharing your questions on our YouTube and our Facebook. Dr. Sarika, can you hear me? I request you to wait, viewers. Hello, can you hear me, doctor? Hello, doctor, can you hear me? Doctor, can you hear me? We are going to talk about Pap smear and self-breast examinations, endometriosis and chocolate cysts. Hello? We are also going to tell our viewers about PCOD and its implications. And whether a fertile period or an unsafe period is there in a cycle, and do we require surgery to treat this kind of period? Can you hear me, doctor? I think we've lost the line. Just give us a second, we'll just get back. Our tech team is trying to get in touch. We just lost the audio for the last 1 minute. We are getting back and we are going to take more questions. Pain before menses, gaining weight, bleeding in early pregnancy and irregular periods. Stay with us. We're just connecting back with Dr. Sarika Gupta from the Apollo Hospital. We just lost the line for a minute and hello, doctor. Doctor, please tell us about Pap smear examination and also please explain PCOD. I am sorry for the fact that we lost the line for a minute. Yes, doctor.
Yes. So Pap smear is a test which is a screening test for cervix cancer, and it is just a small test, and it takes like 1.5 to 2 minutes for a gynecologist to see the cervix and take the cytology, means take few cells from the cervix through a brush. So it is not a painful procedure. It can be a little bit discomfort to the patient, but it's not a painful procedure. Every woman after the age of 25 should get a Pap smear every 3 years. If it is abnormal, then the doctor will tell you more about more tests. But this is a test which every woman should get, whether you have any symptom or not. So a normal healthy woman should get a Pap smear after the age of 25 every 3 years. And PCOD is a disease of the ovary, and it is a lifestyle disease and related to the sedentary and the urban lifestyle that we have now. It is related to carbohydrate intolerance. So somebody who is having insulin resistance, which can be because of sedentary lifestyle, which can be because you are having high carbohydrate laden food or processed food, and not doing adequate exercise, and or you have a stressful lifestyle. So it all leads to a metabolic syndrome, which is disastrous, disastrous to the health of the ovary. So the ovary stops to ovulate, and there are small cysts in the ovary, multiple small cysts in the ovary, and the lady does not have a regular cycle. It can be delayed cycle, and the lady can have like menstrual hormonal disturbances and hair over the lips and all over the body, and weight gain. So there are many. It is related to so many metabolic problems in a lady, and it's a lifestyle problem. Once you change your lifestyle, this can be treated by changing the lifestyle.
Absolutely. My last question to you would be, what is endometriosis and chocolate cysts? Because we got a lot of these queries when we lost the audio, doctor.
So endometriosis is when the inside lining of the uterus, it migrates and it goes into the pelvic cavity or inside the abdomen. So it should be, it is a, the lining should be inside the uterus, but when it migrates and goes inside the pelvic cavity or the lower abdomen, it can sit on the surface of the ovary. So with each cycle, it produces blood, and then you can see cyst filled with blood inside the abdominal cavity close to the ovary. Now the symptoms of endometriosis are inflammation in the abdomen, and that's why infertility or severe pain during periods, and or continuous constant pain in the lower abdomen. So these are the main problems of endometriosis. And another sister of endometriosis is adenomyosis, when the inside lining actually is dispersed inside, scattered inside the uterus muscles. So then there is severe, there is heavy bleeding and pain during periods, and that is also very common. So endometriosis, there is no high risk factor for endometriosis, but women who have it, they can sometimes lead to into recurrent surgeries also, because it is some condition which does not completely cures. It is very difficult to cure endometriosis.
Absolutely. And on this note, I'd like to thank you, Dr. Sarika, for joining us today and for sharing your thoughts with us and your valuable time and insights in educating us on gynecology queries. And with this, friends, this is a wrap of this edition. We'll be back with more interesting episodes in Question Hour next week. Till then, please take the jab if you haven't done so. Stay safe and keep the mask up. On that note, keep watching India Science. Many thanks for watching. Namaskar.